Wouldn't that be good? All right, let's move on. It's Topic Tuesday. And this is from our resident at Cedar Sinai. That's Duke. And we're so happy to have him. He's so good, along with everyone else that contributes here from our medical staff. We have medical staff now. I just dubbed it. All right, here we go. Hello, everyone. We hope your week has gotten off to a great start so far. Today, we will be discussing the role of diuretics in managing aortic aneurysms. Briefly, an aortic aneurysm is a serious cardiovascular condition where the aorta, the largest artery in the body, becomes abnormally enlarged or balloons outward. If left untreated, this can lead to life-threatening complications such as rupture or dissection. Treating aortic aneurysms often involves lifestyle changes, medications, and sometimes surgery, depending on the aneurysm size, location, and the risk of rupture. Diuretics are one of the medications that might be prescribed, even though they don't directly treat the aneurysm. Instead, they support overall cardiovascular health, helping to manage risk factors associated with aneurysm progression. So, what are these diuretics? They are sometimes known as water pills, oftentimes known as water pills, and they help the body remove excess sodium in water through increased urine production. There are three main types of diuretics: thiazide diuretics, which are commonly used to treat high blood pressure; loop diuretics, which are often prescribed for heart failure or kidney-related fluid retention; or potassium sparing diuretics. They are usually used alongside other diuretics to prevent potassium loss. Each type of diuretic has a slightly different action mechanism, but all aim to decrease blood volume and pressure by facilitating the excretion of fluids. So why would diuretics be used for aortic aneurysms? Well, the primary reason diuretics are used for patients with aortic aneurysms is to help manage blood pressure, which plays a crucial role in preventing the aneurysm from expanding. Here is how diuretics contribute to a holistic approach to managing aortic aneurysms. They lower your blood pressure, one of the most significant risk factors for aneurysm growth and rupture is high blood pressure, which is also known as hypertension. When blood pressure is high, it increases the stress exerted on the weakened arterial wall, making it more susceptible to expansion or rupture. Diuretics help reduce blood volume, which in turn lowers blood pressure and reduces the mechanical stress on the aneurysm. It reduces fluid retention and heart strain. People with cardiovascular conditions, including aneurysms, may experience fluid retention, especially if they have associated heart or kidney issues. Excess fluid can increase blood volume and pressure, placing additional strain on the heart and blood vessels, including the aorta. By preventing fluid retention, diuretics reduce this strain, which can indirectly support the stability of the aneurysm. They complement blood pressure medications. They often are used alongside other medications such as beta blockers or angiotensin converting enzymes or ACE inhibitors to maintain stable blood pressure levels. By reducing fluid levels, diuretics enhance the effectiveness of these medications, offering an added layer of blood pressure control. This synergy between medications can lead to better outcomes for patients, as maintaining stable, low blood pressure is a key factor in preventing aneurysm complications. Some of the potential risks and considerations of diuretics are electrolyte imbalance. Diuretics can cause an imbalance in electrolytes such as potassium and sodium, which are vital for muscle and nerve function. They can cause dehydration. Excessive fluid loss can lead to this dehydration, which can strain the kidneys and other organs. And patients with compromised kidney function need to be closely monitored, as diuretics can sometimes worsen kidney issues if not managed carefully. Physicians often adjust doses, choose specific types of diuretics, and conduct regular lab work to mitigate these risks, ensuring that patients receive the therapeutic benefits without adverse effects. Diuretics alone cannot prevent or treat an aortic aneurysm, but play an essential role in the comprehensive management plan for the condition. Regular monitoring of blood pressure, lifestyle modifications, and imaging tests to monitor aneurysm growth are all necessary steps in managing the disease. Medications like diuretics, when combined with other drugs, prescription drugs, and dietary changes and exercise, if it's appropriate, offer a powerful strategy to minimize the risk of complications. In summary, diuretics are prescribed for patients with the aneurysms, primarily to help manage the blood pressure, alleviate fluid retention, and reduce cardiovascular strain. All these together contribute to a safer and more stable condition. By lowering blood pressure and reducing fluid buildup, diuretics help mitigate the risks associated, offering patients a safer path towards managing their health. If you are currently taking a diuretic and would like to know more about them, please reach out to your primary care doctor or cardiologist. And Duke signs off, and that's all we have here for you folks. We hope you found this to be informative. Have a wonderful week ahead. Stay healthy and take care. Duke.